Good evening, ladies and gentlemen. It's my pleasure and privilege to welcome Dr. Vignesh Kumar to the show. So, this is the topper session. He is the topper for the AIIMS SS 2022 exams. He secured CML rank 1 and AIIMS rank 3. Now, there's something very unique about securing rank 1. It is a stamp of approval. It's something you can carry and be proud for your entire life. Now, that is something which is very unique to rank 1. And I have with me Dr. Vignesh Kumar. We're going to try and dissect out his strategies, his thinking, and his thoughts towards cardiology in this session. So, welcome, Dr. Vignesh. Welcome to the show.
Hi, sir. Thanks for organizing me.
Yeah. So, I'll just introduce Dr. Vignesh. He's done his MBBS from Stanley Medical College. He's 2011 batch, and he's done his MD General Medicine from the same college which I did mine, which is Madras Medical College, the old and prestigious Madras Medical College. Basically uh, we'll just repeat this. Yeah, 2018 batch, right?
2018
MD medicine. Yeah, so I'll just repeat that.
18 months.
Yeah. So I'll just give a brief introduction about Dr. Vignesh. So he's done his MBBS from the 2011 batch from Stanley Medical College, Chennai, and MD medicine. He's 2018 batch. He did in the same college where I did my MD medicine, the old and prestigious Madras Medical College. So and after that, he's just worked around a bit as a physician, and right now he's working in an ICU setup and he's cracked the exam, and that's something which is very unique. So I would like to offer my congrats and welcome to the show, Dr. Vignesh.
Thanks, sir. Thank you so
much. So Vignesh, where are you working right now presently?
So I'm currently working in a private hospital ICU.
ICU. So you'll be seeing all sorts of cases, cardio, neuro, nephro, gastro, all sorts of critical cases, right?
Yes, sir. So basically medical ICU.
So it's a privilege actually talking to someone who's working, because all of the candidates right now have they basically prepared for entrance exams and none of them are working. So first time I'm seeing somebody who's actually working. So we'll go to that bit later on. So Dr. Vignesh, so you've secured rank 1 and it's like it's not like NEET where you study and then you choose a subject. Here you have to choose your subject first and then go write the exam. So why did you choose cardiology as a subject?
Sir, during my MP days, among all the specialty cases, I felt and I could see that most of the cardiac cases, patients are getting relieved soon after intervention or management, which gave me the immense satisfaction. And also in cardio, we do everything what we love doing in medicine, like doing interventions, handling emergencies, seeing interesting cases, clinical findings, and the vastness like structural heart disease, pediatric cardiology, electrophysiology. All these made me pick cardio as the branch of my choice.
Cardiology is a very vast field, and what we learn in MD medicine is barely scratching the tip. In fact, once you finish your DM, there are so many fields to explore. You can be a super specialist in this cardiology itself. For example, after finishing a DM fellowship, a DM cardiology course, you can go for say an electrophysiology fellowship, and then you can be either a device specialist or either you can be an ablation specialist. So you can keep on subspecializing. So that's something which is so vast and that is seldom known by medicine PGs. So Vignesh, we'll just go back to your initial days as a PG. So you chose MD medicine at Madras Medical College. It's one of the most prestigious and oldest colleges, and you see a fair variety of cases. Since I've been a PG also, there you see all sorts of varieties of cases. So how could you prepare amongst for your super specialty amongst this? Because I know it's very hectic. There are so many patients. There is so little manpower for that degree of patients. So how could you prepare for one for your MD medicine course and two for your super specialty preparations?
So honestly speaking, I didn't do any preparation during my MB days, sir. We could see a lot, wide variety of cases actually, and the schedule there will be a bit hectic till the second year gets over. And also, second years we got the COVID period, so we are working continuously in our career also. So I couldn't find any
You had a
time.
COVID batch.
Yes.
Do you have your super specialty postings at that time because of COVID? Was it cut off or did you have it?
Unfortunately, I was the batch whose secondary technical postings got cut off, sir. I did it in my third year only.
Yeah, it was actually an emergency period. So You have to take
Yes.
that in your chin. So,
Yes.
so, so because of your hecticness and because of COVID, probably your academics would have been affected. So around this time, how did you prepare for your MBA for a MD medicine course? Did you read Harrison? Did you read all your standard books like Cecil or Goldman? So we're talking about MD medicine. We'll go to super specialty a bit later on because a large majority of our PGs, our audience is basically medicine PGs, and they not only want to crack your super specialty, but first they have to clear your MD medicine. So, how did you approach MD medicine preparation for MD medicine in say first year, second year, and third year? So, how was it? Did you read? How was your approach to it?
So in first year, I hardly get any time to prepare for the exams. In second year, by second year end, COVID, we had the COVID period. So in my third year, only during the last 3 months, I could browse through Harrison. That was the only time we prepared actually. Most of the knowledge we acquire like clinical only.
Clinical. So, how did you read Harrison? So, did you read Harrison cover to cover? Like most of the medicine PGs in the country attempt to do so. Whether they succeed or not is different. So, how was your preparation of Harrison
No,
in
sir,
your MD days?
no, I could just skip through the important topics and the questions which are repeated frequently in the MD exams. Only that much time I could get in the.
So,
I didn't read
one
cover
thing,
to cover.
yeah. One thing I'll tell you is that even in my days in the same college, none of us used to read Harrison. So because I'll tell you, we were 24 of us. So I think only one or two guys actually read Harrison. So the others did not even read more than 10% of Harrison. So when I come outside and meet other people from other state colleges, it's like everyone reads Harrison. But somehow in my MMC and in other Tamil Nadu medical colleges, not many people actually used to read Harrison. Is that the same now? Were your colleagues actually reading Harrison cover to cover, or were they too busy in their works?
So most of them will be busy in their works. I think around hardly one or two reads Harrison. Okay.
I think that was the same ratio where we were there. See, I think it's very important for medicine PGs to know. See, there are lots of approaches where you can learn this great subject called medicine. Okay, there is more than one approach. For example, it is not essential that you absolutely have to read Harrison. I will be very clear. I'm saying it's not. I'm saying don't read Harrison, but you can still be a good doctor and you can still crack your entrance exams even if you don't read Harrison. So I tell you, told this openly in multiple platforms that I have read less than 10% of Harrison even then and even now. Okay, and we see another topper here saying that even Harrison, he has not read much of Harrison. But remember, it is good to read Harrison, but it should not be an absolute essential that if I don't read Harrison, it's something like I'm zero and I'm not going to be a good physician. It's nothing like that. Please remember, there are many approaches you can choose to take, learn the subject. For example, whenever the most important thing I feel is that we should be whenever we see a case, we should learn that. We should immediately try to read about that. So the greatest resource I had was my mobile phone. So anything I used to immediately go to up to date. So is that still being followed? We use a lot of up to date there.
Sir, what I actually feel is being bedside and learning bedside is the best way for any physician.
Exactly.
And regarding any doubts we get during those period, I think referring to the standard websites like up-to-date will help.
Exactly. So when in your opinion is it a good time to start studying for super specialty?
Sir, I think there are two kinds of preparation. The first kind is like that some will go by reading the standard textbooks. They have to start earlier. That will take around some 4 to 5 months, more than 4 to 5 months of preparation. The second thing is the shortest way, which I followed. For people working like me, it is the best way, I think. Sticking to a good platform like Marrow, where you can get your concept right and get the basic understanding of the subject better, will help you in clearing those exams. So, seeing those videos and solving some MCQs will help you clear the exam.
So did you read Braunwald?
Uh, Sir, I didn't read Runwall during my last NEET SS attempt. This time, I just revised your videos once again, which I did during the last NEET SS exam, and I just read some 4 to 5 topics from Runwall, which usually get repeated often in INI. Other than that, I didn't read Runwall.
So, yeah, so to those who don't know, I have known Vignesh for the better part of 1 year right now. So I think he contacted me through Facebook last December. So for the last NEET, he had actually secured around a rank of around 70, and I thought that he had actually joined, but later I came to know that due to some personal problems he did not join, and it made me very happy to know that the same guy who I knew actually got rank one this time. So once again, I should offer my congratulations, because it's very difficult to not take a seat. It is a huge. It takes a lot of guts not to take a seat. Well, when you have something, you automatically want to grab it with both hands. But he's got an even better opportunity right now. So hats off to you.
Thank you, sir.
You have finished your MD medicine. So a lot of times, many people, including me, usually, and most of the graduates right now, would have a confusion: should I practice as a physician, or should I go forward and take a super specialty? So there's a lot of confusion there. So you practiced as a physician for quite some time, and then you took a super specialty. So could you help us out? Is it when did you decide to take a super specialty, and why did you do so?
But after completing my MD, I was inclined towards continuing medicine and practicing medicine. So I worked
So
in a
working as a physician.
COVID ICU in a peripheral hospital of my college. Then after some 4 to 5 months, coming to know that this year has shifted towards super specialization, I thought that I should give my exam now. And so I started preparing for NEET SS. That time only I came across your video of RK preserved infection, which
Yeah, that was
terrified and
pretty.
that made me subscribe to Marrow, sir.
Yeah. Okay,
Then I
so
started preparing for NEET.
yeah, so you initially worked as a physician, and then after some time you decide, okay, now I'll take my super specialty. So is it so? What is your opinion on continuing to work as a physician, or is it mandatory that you take a super specialty? So could you help us out on that?
Sir, I personally feel that taking super specialty is a choice. It's not mandatory actually. Doing specialty is mandatory nowadays, uh, but it's like one's own wish and to complete it as soon as you finish your MD, taking into account the level of competition now.
Yeah, yeah. See, I'll give you my opinion. See, you know, MD medicine is a very vast branch. Okay, and it is very difficult to master a very vast branch. Super specialty is comparatively very easy, and in my opinion, probably the easiest super specialty to learn as such is cardiology. The reason is, if you look at it, 90% of your cases is basically three or four diseases. Coronary is basically, when you talk about adult practice adult cardiology, it's basically coronary artery disease, it's basically heart failure, it's basically hypertension and its complications, and you're practically done. And valvular heart disease, and you're practically done. And all you have is four or five drugs. You have ACE inhibitors, you have beta blockers, you have diuretics, you have statins and antiplatelets, and you have digoxin. So those are your basic drugs, and those are your basic diseases. You can manage 90% of cardiology like that. It's not something very complex like neurology or endocrinology. So that is one very good attraction of cardiology. So one thing I would like to say is, that many people have this. When we finish as physicians, when we finish our MD, so we have this general thing that I want to stick as a physician, or I would like to go and specialize as a super specialty. So I want you to know there's some harsh realities to it. So when you practice as a physician, okay, we like medicine because because it is complex, because there is a lot of critical complex decision making, there is a lot of critical care involved. Okay, this is mostly possible only if you are in a medical college or in a premier institute. Okay, it is not that when you're in some or when you're in some private hospital, or you're in some clinic, or let's say you're in some nursing home, most of your cases are going to be simple cases. They're going to be diabetes, they're going to be hypertension, they're going to be pneumonia, sepsis. The critical thinking that you require, your diagnostic approach, that might not be required to that extent. So it's fine to practice as a physician, but remember, the joy which we get in practicing the complex critical care decisions that you make, that is mostly in an institute based setup, or when you're in some medical college based setup, where you have all these complex cases which are referred. Okay, when you are practicing real world medicine, it's basically, all your a lot of thinking usually happens at your subcortical level. So that is one thing I would like to convey. And in my opinion, I think super specialty, taking super specialty is actually almost mandatory right now. Okay, because you can practice as a physician, but I would I recommend that most of you guys take super specialty, because we are living in an era of more and more specialization. People actually come to you, come to specialists. So if you are having diabetes, people demand an endocrinologist. If you are having chest pain, even if it's non-cardiac chest pain, they come and see a cardiologist. So people are becoming more and more aware. So you want to future proof yourself. So coming back to Vignesh, how when you decided to start for uh, learning about cardiology? So how long? What was your primary approach? So how did you start with learning cardiology?
Sir, I knew that I had very little time to prepare. So
So around
I
what time
thought
was
that I
this?
should get the concept clear. So I
Yeah.
want to, after seeing your video, I subscribed to Marrow. So I started started watching your videos, and I got the basic concepts in cardiology and gave my NEET SS exam. This is the basic approach which I had, and I solved some MCQs. Initially, Marrow didn't have MCQ bank. This time, luckily, I had the MCQ banks.
So were you able to complete all the videos?
Sir, last time I could complete around 60 to 70% of the videos. This time I completed the videos.
Entire video. So how long do you think
Entire
it
videos.
will take to complete the videos approximately? So if you have time, how long would you take to complete the videos?
So I
I
think
think there are
for completing the entire video modules, uh, the period of around 25 to 30 days should be sufficient.
20 days.
With
Okay.
efforts, we can even complete in 20 days.
Yeah, so that is very important actually, because because NEET SS is now general medicine based, and after that you have the INSS, which is actually your specialty based. So it requires actually 1 month of time only to finish off the entire videos. So Vignesh, so you've gone through the Marrow app, you've seen all the videos. So how do you like the videos? Was it engaging? Was the concepts made very clear? Was the subject presented in a say clinically relevant way?
So what I feel is like most of the questions asked in the exams will be from 30 to 40% of the topics. And I think those topics are pretty much well covered in your videos, sir. And the way you narrate the facts and history before each video made me watch the video again and again.
So any particular favorite topics that you liked among all the
So
videos?
congenital heart disease part is my favorite, sir, actually. I think
Actually,
no one
congenital.
could read those books on congenital heart disease like 12 of and Park in a very short period of time. But I felt more confident in answering questions after watching all the congenital heart disease videos.
Exactly.
That is my
So
personal
see,
favorite.
congenital heart disease is the rank determining part of cardiology for INSS. One, because it's difficult. Okay, it's not something you see in cases. So if you're a medicine PG, you don't go around seeing TOF or TGA cases. You might see occasionally a TOF case, but it is not routine. Okay, and that is something which we cannot relate to. So, and the books are voluminous and they are confusing. For example, there are so many different names for ventricular septal defect. So all of this is very confusing. So, and since it is difficult to study and since it is not relatable, it is the rank determining subject, rank determining part of cardiology. So if you can master congenital heart disease, or if you can answer a large proportion of questions from it, you will almost always get a seat, because the other questions might be a zero sum game, because everyone's going to answer. Congenital heart disease, in my opinion, is the rank determining field. In fact, when I started the topic itself, I said that in an exam where they ask questions on congenital heart disease, it is the rank determining field. In NEET SS, probably not, because congenital heart disease, I think, is basically a cardiology topic and it doesn't come under general medicine a lot. So I think, so all of you guys who are very interested in taking cardiology, and especially through the INSS platform, please concentrate your efforts on congenital heart disease. It's truly well worth it. So Vignesh, so you how many questions did you attempt in the INSS 2022 exam?
So I attempted 77 questions
Out of 80. So another
out
thing I
of
always say, always attempt at least 95% of questions. You can go through all my videos, all the toppers videos across various subjects. Almost all of them attempt more than 75% of 95% of questions. So please always attempt as many questions as you can. If you can rule out one option, also try to attempt it. Okay. And so Vignesh, how did you practice for your MCQs? Did you use the Marrow Q Bank? Did you use any other books or something to practice for the MCQ exams?
Sir, I didn't use any book. I just solved the Marrow bank and I gave one of the settings, sir, 2 days before exam. That's it.
Yeah, mock exam. So How was your performance in the mock exam?
Sir, I gave the exam after the stipulated time
Okay,
period, so I got a
fine.
predicted rank of 2.
Two. So at least the prediction was fairly accurate. So do you feel that you need to solve more and more MCQs before you go and write exams? Is it mandatory that you keep on going maximum number of MCQs possible?
So for NEET PG, I think it's mandatory to solve more number of questions. For super specialty, I think you should get the concepts correct first,
Exactly.
and after building on the base, you can do some MCQs just to avoid silly mistakes. That's what it is.
Exactly. See, I think you should practice a good quality MCQs. That's very important. For example, if I see, there's no point in practicing MCQs just for the sake of practicing. For example, if I put a question as pulses paradoxes is seen in all except 1, 2, 3, 4, that doesn't make any sense. Okay, you only have to learn the cause of pulses paradoxes. A good question will frame it in a clinical scenario, and there'll be a lot of all except something like that, and you have to really think to answer that question. Those are good MCQs, and that will actually help you in the exam. In fact, you look at your INISS, most of those questions are like that. There's no point in simply asking direct questions. Okay, so please understand that working out more and more MCQs on that particular topic doesn't help unless they are good quality MCQs. And I hope that Marrow is able to cater that for you. So after you finished your INSS, how confident were you of getting a seat? How did you rate your performance?
This exam I felt on the tougher side, sir. After giving the exam, I had more doubts on which could be the answer because most of the questions were like all of the following except, and we have to
Exactly.
read and rule out each option before answering. Then after coming back and recalling the questions and checking the answers, I thought that I will get a rank within 10, but rank 1 came before questions.
So a good question paper actually makes you think. So I think this was, in my opinion, a very good question paper. So again, you qualified and then you had to attend your interview. So how was your performance in the interview? Did you prepare a lot for the interview?
So I didn't prepare much, sir. I didn't even attend the mock session because I was working that time too. So
Yeah,
basically,
exactly.
the entry was so the easier side only. So they usually ask some basic questions. What they expect from you is to have the correct approach, not like directly jumping to the diagnosis and having the basic approach before. They ask some 3 to 4 clinical scenarios on common topics, and there will be a different question on thesis.
Exactly. So if you look at my, I had a mock session actually. So I think you were not there as you said. In
Yes,
the
sir.
mock session, the entire mock session was actually around 20 minutes. Okay, in those 20 minutes, I only said two things. One, they can ask you any random question, so there is no point in studying for it. Okay. Two, go and study your thesis. This was the only two things I actually stressed. So study your thesis, and then don't bother about anything else because there's no point in studying for it. Okay, so I think that was the approach. I think all of the candidates who wrote it gave me the same feedback. This was the same thing which they asked.
Yes, sir. Questions will
Okay.
be random in all of those topics.
Random.
So
So yeah,
there is
exactly.
no particular
So there's
point in
no
preparing.
point exactly. So if your exam is online, as it might be in the future, so at that point there is no point in repeatedly trying to break your head trying to guess what the examiner is going to ask, making stations like this is for cat study, this is echo images, this is X-ray images, when they can ask you any random question. Perhaps in the next INISS, they might give you they might call you to AIIMS and they might give you a spotter session. In that case, preparation would be helpful. But if your exam is online, probably not much. Cardiology is a very interventional branch. Okay, it requires hand skills. That's what people say actually. So when you talk about MD medicine, to talk to MD medicine people, people take endocrinology, take rheumatology. Okay, because there is no intervention. They say that they are bad with their hands, so they prefer some non-interventional branches. Okay, and people take cardiology, gastroenterology, because they want interventions. So, what do you feel is hand skills important during, like, if you have good hand skills, like you can place central lines, you can put lumbar punches, you can place difficult IV lines. So, there's some degree of hand skills there. No? So, you feel hand skills are important for when you choose a subject like cardiology or something like gastroenterology, which is interventional in nature.
What I feel is having the hand skill beforehand is not much important. The interest in
Exactly.
the field will make you develop much more hands-on after getting to the field.
Exactly. See, this is very important. I want to tell you. Okay, so Dr. Vignesh, so when we interview MD medicine people, they some people take endocrinology, some people take rheumatology, saying that they want non-interventional specialties. Well, that's fine, but they do so because they feel their hand skills are bad. Okay, that is something actually I have an objection with. And people who take interventional specialties like cardio and gastroenterology. So, do you feel that hand skills are important? Let us before entering DM, do you feel that hand skills are important to become a good cardiologist or gastroenterologist?
Sir, what I think is having good hand skills beforehand is not mandatory. What is wanted is the interest in the field, which will make you develop much more better hands-on after choosing the field.
Exactly.
And it's
This is
actually a learning curve which helps you doing better.
exactly. See, that is something which is very important. I want all of you guys to be very clear on this. No matter how bad your hands are, okay, as long as your fine motor skills are intact, okay, I think you can take cardio or gastro, okay, or your interventional specialties. Okay, do not skip these specialties just because your hand skills are bad. Okay, those are something you develop, and that and it is not like you need extreme hand skills at least for cardiology. So if you like endocrinology, if you like rheumatology, please take it, but not because you feel that your hand skills are good or bad. Okay, so hand skills, whatever hand skills that you have in your MD medicine doesn't make a difference. DM, cardio or gastro is an entirely different ballgame. So Dr. Vignesh, so you've written both your NEET SS, you've scored a rank of 470s, and then you've written your INS, you've scored rank one. So both follow different syllabuses. So one follows an MD medicine, let's say your MD based syllabus, and the other follows, you have to basically prepare for that particular subject. So is it possible to do both? People would like to know, na?
Last thing,
Because NEET SS
la-
has NEET SS has a large amount of seats, so you would want that to practice that, but at the same time, you don't want to miss the premier institutions in the country. So, is it actually possible to prepare for both?
Last time when I gave NEET, the pattern was only specialty. Now it has
Specialty based.
changed to medicine.
Yes,
Basically, preparing medicine needs much more time than preparing for
exactly.
specialty. Yeah,
Medicine is very difficult, right?
yes, sir. It minimum requires some 4 to 5 months of dedicated preparation. But for specialty, you can prepare for just 1 to 2 months and can give the exam. What I feel is giving NEET assess will help you in solving the medicine part of the specialty exams you're going to give for INAS. So I think giving both exams and preparing for both is quite possible.
So, what I would actually recommend is, prepare for NEET SS, because that is, I think, a much more difficult task, and you have a larger amount of subject to learn. And you can, if in case of cardiology, actually you can finish the entire thing in 1 month. So if you have a 1 month interval, you can learn cardiology very well, especially if you use an app based preparation like Marrow. I think you can cover the entire thing very well. So that is my recommendation. Please actually focus on both. Do not focus only on one, because NEET is the larger amount of seats, and INSS is your premier institutes. Vignesh, you use the Marrow app. So how do you feel we can improve on this app? Do you feel that any further topics need to be covered? Anything needs to be focused or highlighted? So we are always open to improvement. So do you feel that anything needs to be added with respect to NEET SS or INSS preparation?
The videos now currently in the Marrow are concise and crisp. Adding them will make them difficult to finish. I think
Exactly.
adding a separate session for TM postgraduates to in certain topics like echo and angiogram would be helpful.
I think that is something we can leave it to the Marrow team to concern. So I hope that it actually caters. We hope that it actually caters to the needs for the entrance based preparation as well as for your MD medicine. So I think the time Marrow app came, it was actually when you were probably when you were in the late second year or probably entering into final year, right?
Yes, sir.
So how was
It
it
was my
helpful?
final year.
Your late final year. So I think you would have not got the entire benefit, because it's helpful around second year. So if you see a case, you can actually read it from the Marrow app. So that is something we use our experiences, and so that we although we advertise ourselves as a entrance based platform which aids in candidates securing a better rank, we as clinicians actually want it to be useful for the bedside. So it has to somehow benefit the patient. So if whatever you can learn from our videos, if it benefits the patient, that is actually the best gift you can give us. So I hope that for all the PGs seeing this video, please use it more and more with respect to the patient. So especially if you are in your second year, if you see a particular topic, let's say you see a case of Guillain-Barré syndrome, so please go and look up at the Marrow app and look at what Baishak has to say about GBS, or look at what Rakesh has to say about GBS, because that is something which is not available in your textbooks. Experience cannot be taught. So even if you look at my videos, we always start out with a case. So in this case, I faced such a difficulty. I made an error in this case. So that somebody else pointed out the error of my ways. So this is something which is not there in textbook. So you can learn from the mistakes which we made. You can use our experience also to learn. So I would like even PGs to use this more and more for your clinical based preparation. So, Vignesh, so any ideas on which where are you going to go next? So it's all Chennai for probably the best part of 10 years. So any idea where you're planning to do your DM?
Sir, I'm yet to decide on it, sir. I'm confused between PG and JIPMER.
It is a it's a terrific choice to be the between the two premier institutes in the country for DM. It's either PGI, either it's Chipmer. So anyway, I wish you all the best for actually that choice. So that both are equally prestigious institutes. Okay, one is probably near your hometown, the other is a bit far away. So anyway, it's something that you should. It's a decision that you should make on your own. That is something I cannot help you there with. So anyway, Dr. Vignesh, it's actually a privilege talking to you, and I have learned a lot of things, and I hope that all the PGs who actually see this can utilize the experiences which Dr. Vignesh has given through this video, and secure come out for the next exams in flying colors. So thank you, Dr. Vignesh. Thank you for accepting our invitation. And you are now part of the cardiology fraternity, so it's a very closely knit fraternity. So we'll be seeing somewhere around some conferences somewhere. So hopefully, thank you, Vignesh, and thanks for all this. Thank you, Vignesh.
Thank you, sir. Thank you so much.